Today I want to go over a movement series that you can do before your next respiratory treatment. So we know with the respiratory treatments, the goal is to help clear as much mucus as you can, kind of warm up the rib cage and get the lungs working as efficiently as possible, right? Well, from a muscular standpoint or a movement-based standpoint, if you do a couple exercises before your next treatment and allow that the rib cage to warm up and get the muscles to work well, that can kind of help the tail end or the indirect effect of what you're trying to accomplish when you're doing your nebulizers or using the vest and stuff like that. And if you want a little bit more science on why this is a good idea, check out our YouTube channel, Cystic Fibrosis Fitness Institute. We have a couple videos there with exercise preparation and stuff like that. So today what I want to do is we're going to go over two exercises. We're going to go over rib tucks, which we've shot a lot of videos and stuff on, and then also an exercise what we call sidelying rib rotations, okay? So when we think about this is your ribs are going to expand out and there's a little bit of rotation, right? Well, on the back side of your ribs is going to be your spine, okay? So when those expand out, that's going to change kind of the direction of your spine because they're located on the back side. So that means is when we're working on warm-up exercises, we need to do exercises that kind of help expand it back and forth, up and down, side to side, and also rotational. So these next two exercises, rib tucks and sideline rib rotations, are going to be great exercises to do before your next respiratory treatment, okay? So, we'll put this foam roller aside, we're going to use this in a second, but the first exercise goes back to rib tucks, which we've discussed further in detail on our channel. Quadruped position, hands under shoulders, knees under hips, tuck the toes under. You're going to take a nice big deep breath, and when you exhale, you're going to round your back, but you're rounding your back by tucking your rib cage down and back. So that's why we call them rib tucks. You're not trying to push in to the turf. So you'll do anywhere from 3 to 5 breaths depending on how you feel, really trying to tuck the rib cage and round it to, once again, we're working on this mechanics. And then the next exercise we're going to do is what we call sideline rib rotations. So I like using a foam roller, okay? Or if you have pillows, books, whatever it is, the goal with this is we just want to be able to place it under our knee, okay? So what we're looking here to do is keep the bottom leg straight, then we're going to put that foam roller on top, bring the leg on top here. The reason why I like this is it puts our hips and our lower back in a great position, okay? Now if we were to drop it and do it like this, it rotates our lower back. So it's going to change the positioning, which is not going to allow that rib position to happen, okay? What you're going to do from there is you're going to bring the arm you're laying on above your head so you can lay there. You can't go here, but it feels a little bit better right here. Then you're going to take the top hand and you bring on the bottom side of the rib cage. So we're going to go right at that rib cage, the one you're lying on. You're going to take a nice big deep breath in. And when you exhale, you're going to subtly pull at the ribs, just ever so subtly. Then you're going to breathe in, come back through. As you exhale, subtly rotate. So what we're doing here is, now we're working the ribs and we're working the spine from a rotational standpoint. So the rib tucks allow us to open up and expand the ribs front to back like this, and the rotations are going to add this component to it. When you put all those together, it allows the ribs and allows everything to expand. Because remember, what's the goal of the respiratory treatment? Be able to get in as much air as you can, get all the mucus clearing out. Well, we want to help allow that to happen by changing the mechanics of the rib cage and the muscles. So try that out. Go from rib tucks, rounding, do 3 to 5 breaths, and then lay on your side, and do this on both sides. Remember, legs straight, top leg about 90 degrees or knee in line with the hip. Relax, take a big breath, rotate, and come back through. So 2 simple exercises that if you put in a series together, rib tucks and sideline rib rotation, it's going to help open up that rib cage and give you a little bit more expansion. We talked about this kind of doing a warm-up before your respiratory treatment. So try those out, see how those are. We'll have different levels of recommendations from level 1 all the way to level 3 at the end of the video, and see how those work before your next respiratory treatment.